is basically this is like a template that I use. I still use it. I'm third year and I still use it for my admissions. It is kind of arranged in a way that will help with your presentation as well. So that presentation should be running in the SOAP pattern, so subjective and objective. Once I got the admit, I basically take the name, put in the MRN, and the VA ward, it goes by the last four, basically. And then the past medical history, this is what I put in my one-liner here. Any past surgical, usually anything relevant. And then the chief complaint at the VA, I'm not sure if you guys have a clue or not, but usually the best spot to look for that one is opening the ED triage note. Okay, ED triage note, and I'll show you on the chart where that looks like. When you have a new admit and you look into the notes, you will see like the very first note from the day of admission. It will be the ED triage note, and that's like the first person who encountered the patient and documented like why the patient is in the emergency. So I usually start by that. I say like this is the chief complaint. HPI is like I leave it to when I go to the patient and talk to him. Review of systems, just like standard thing. I put in the code on the side, so we always like go talk to the patient and we forget to talk about the code. So always remember to document the code. And then we have the exercise tolerance. Remember always to document that. And then the ADLs. We need to document the ADLs, like if the patient is able to take off the activities of daily living. Is the patient able to take care of himself? This is really important at the VA. Most of the people are kind of like frail, they are tired, they need some help at home. So you need to figure out, is this the baseline or is it below the baseline? And usually when we admit people, this is like when they have like a dip from their baseline, and then we'll try to bring them back to that, whatever their baseline is. So if the patient is already bedbound and he's not able to move around or anything, I think probably like it's not a big of a deal. But if he was like functioning and moving on his own, that's a big difference. Allergies, home medications, family and social. Home medications is actually a big one. I always emphasize a lot on home medications. You need to do a good med rec on admission. You probably will need to call the SNF, call the family, check the chart. You might need to call a pharmacy just to figure out what's going on with the home medications. And you need to ask when was the last dose was given. Very big emphasis is on the home medications, and the attending will also be very interested to hear about the medications. What is he taking? When was the last dose? Family, social, big one on the social. Like smoking, alcohol, drugs, but the living situation is very important because it will make a difference in the discharge planning. Then you can get like the vitals, the initial vitals, any subsequent vitals if anything changed. Then pretty much, here, so one-liner, this is the subjective part with allergy, medications, family, social. You're done with the subjective part. From the ED course, this is when you start talking about the objective part of your presentation usually. So you get to take to the vitals and then physical exam. And this is usually like the labs that get done in the ED. So you have CBC, Kim panel, some people have the LFTs, BMP, tropes, lactic, urine drug abuse screen, and UA, procalcitonin, micro, if anything was picked up. And this is like an empty space to put any weird extra labs that sometimes get checked in the ED. Then imaging, X-ray, almost everyone get X-ray, CTs, whatever the CT is, head, abdomen, whatever. And then we have like a big interest in the TTE all the time. Because TTE is very important when we decide to give fluids or if the patient having like an underlying valvular issues or pulmonary hypertension. So TTE, we try to dig from the beginning and see if we have any recent one. EKG in there, and this is like the whatever the emergency department give the patient, what kind of intervention they gave. So basically this sheet will give you like the whole subjective and objective information in one page. and you can, from there, you can recognize the patterns and decide what is your problems, and you start recognizing, okay, I'm dealing with pneumonia, I'm dealing with CHF exacerbation, I'm dealing with a GI bleed. You can tell if you have the all of the information in front of you in one page. Any questions about this one? Anyone have any comments or any issues for these two files so far? The one liner and the history and physical. Otherwise, we can keep going. All good. All right. So we're done with these two. Let's dig into the presentation.